front line in the fight against COVID. This is a pop-up vaccine clinic in Aylmer, southwestern Ontario, one of the province's least vaccinated areas. As the fourth wave grows, these workers know it's on them to help turn the tide. Outside, these residents do too, streaming in as soon as the doors open. 14-year-old Isaac Peters is getting his first shot.
Little poke. It was just a needle. It helps the community out to get this coronavirus out of this world and to help the elder people.
These are the willing, but in this area, they're just barely a majority.
I don't understand why it's such a big deal to some people, but for me, it's just, you do what you can.
Aylmer is a town of 7,500, nestled amid lush farmland deeply rooted in religion. Just over half of those eligible here and in the neighboring communities have received a vaccine. Compare that to about 80% across Ontario.
It's all about trust.
And continuing to build it is crucial, says the area's top doctor.
Stigmatizing doesn't help, judgment doesn't help. Support and education and reaching people where they're at does help.
But those messages are struggling to get through.
We talked to several people at this park. Most did not want to go on camera, and most were either vaccine hesitant or outright opposed to getting a shot. Some said they don't fear COVID, others said they don't trust the science.
This father was the only parent here willing to speak publicly, echoing the sentiments we heard from so many others.
I'm a little bit scared to get vaccine. If you look the internet, it's like 50-50 people says like we have to get, and another 50% says like we don't because it makes worse.
So have you seen the statistics about how effective the vaccines are for reducing hospitalization and death?
I didn't see that exactly the numbers, but I heard it was cases that people get vaccine and they had some problem. And I'm not sure if it's fake or true.
Welcome home.
Aylmer has been a flashpoint throughout the pandemic. Last November, thousands gathered here for a so-called Freedom March, decrying masks and lockdowns as other residents staged a counter-protest. Many in the crowd belong to the Church of God Restoration, a controversial congregation led by Pastor Henry Hildebrandt.
Freedoms are not theirs to take away from us. Christians died for it. People fought for it. The freedoms are ours.
Hildebrandt has repeatedly broken public health restrictions, opening the doors of his church even when it was prohibited, railing against governments and mainstream science. He's a divisive voice in the town, but one with hundreds of followers.
Do you take pride in this area being one of the least vaccinated in Ontario?
It's not about pride. It's not about pride. It's about saving lives.
How is it about saving lives?
It's saving lives because I will not be injected with something that you cannot prove to me is working or is safe. And I will not keep it to myself either.
Why do you feel like you can say it's not a vaccine when people who've studied vaccines for decades are saying it is, in fact, a life-saving vaccine?
They're saying it because they know people like you will believe it. Okay, they know that the majority of the people will just blindly follow. I'm not one of them. Senator Lindsey Graham, he was vaccinated, fully vaccinated,
but Lindsey Graham,
he got COVID?
Yes, but in his tweets announcing that he got COVID, he said that had he not had the vaccine, his symptoms would be much more severe. And he said he was happy that he got the vaccine.
How does he know? How does he know?
Science.
All I know, no, he's not science.
If some here are intransigent, the push now is to appeal to the purely hesitant. This radio station broadcasts in Low German.
New cases.
The language spoken by many in Aylmer's large Mennonite community. It relays information from the local public health unit to the public.
The misinformation, what do you want to call it, gossip? and it spreads.
Do you feel like your message is getting through over some of the misinformation that's out there?
I would hope so. I think it's hard to measure, but I would really hope that people would, some of these testaments that we're relaying that they would speak to that.
Some community leaders have even broadcast their own vaccination experiences, trying to make it less daunting for others. Abe Harms is one of them.
I always feel that this is the most effective is when we say what we've done. I'm one of the leaders in our Mennonite community, and I got both shots. So there are a lot of us that did.
And so how do you try to appeal to those people in your community who are hesitant?
Well, we're going to continue to do what we've done, stay with a consistent message, a message that is always in line with public health. And so we're going to hope and pray that more people take it up.
A hope fueled by those deciding just now to get their shot. Ellen Morrow, CBC News, Aylmer, Ontario.